With the flu season upon us, flu vaccination got underway on Friday nationwide. In this first stage of the rollout, free vaccines will be offered to 11 vulnerable groups. They include medical professionals, people aged 65 and older, people with chronic diseases, preschool teachers, and pregnant women. Starting November 15th, free shots will be offered to people aged 50 to 64. The Taiwan Centers for Disease Control advises leaving at least 7 days between the flu shot and any COVID vaccine.
It's day one of flu vaccination at this Taipei community center. Older adults and other at-risk groups wait their turn to roll up their sleeves. Each arrived with a health insurance card in hand. They also had to bring their COVID vaccination record so that nurses could approve them for a flu shot.
The main reason for that is we were worried that these older folks would forget when they had their COVID shot. Perhaps they have just gotten their COVID shot. The guidelines say to leave an interval of at least 7 days between vaccines, so we specifically asked them to bring their yellow vaccination card.
Starting October, Taiwan will administer the flu vaccine. Also being administered are the pneumococcal vaccine and shots for COVID-19. A 7-day interval is advised between each vaccine to prevent diagnostic confusion between their adverse effects.
There are no studies on the consequences of getting these different vaccines at once, so the guidance is to leave at least 7 days between the COVID-19 vaccine and other vaccines. However, if people don't get these other vaccines because they're getting the COVID-19 vaccine, it's possible we'll see more of those other infectious diseases.
Flu season was mild for Taiwan in 2020 and 2019, but experts fear an impending influenza wave this fall and winter. On Friday, the Taiwan Centers for Disease Control held a press conference to urge high-risk groups to get the vaccines they need.
We haven't had a flu or pneumonia epidemic for 2 years. Heaven forbid we get one this year. Some people experience a faster decline in antibody levels. They are more vulnerable if they come into contact with viruses. So we do still urge vaccination.
This year, the government purchased 6.32 million quadrivalent influenza vaccines, which fight H1N1, H3N2, the influenza B Yamagata strain, and the influenza B Victoria strain. The vaccines were manufactured by companies including Sanofi, Adimune, and TTY Biopharm.